and welcome to the conference call with the management of Aster DM Healthcare for an update on impact of COVID-19. Call hosted by ICICI Securities. As a reminder, all participant lines will be in the listen-only mode, and there will be an opportunity for you to ask questions after the presentation concludes. Should you need assistance during the conference call, please signal an operator by pressing star, then 0 on your touchtone phone. I now hand the conference over to Mr. Sriram Rathi from ICICI Securities. Thank you, and over to you.
Yeah, thank you. On behalf of ICICI Securities, I welcome you all to the conference call with the Aster DM Healthcare management. We have the senior management with us today to discuss the impact of COVID-19 on the industry and the company's business. We have with us Dr. Azad Moopen, CMD, Ms. Alisha Moopen, Deputy Managing Director, Dr. Harish Pillai, CEO Aster India, Mr. Srinath P. Reddy, Group CFO, and Mr. Sumanto Bajpai, Head Investor Relations and M&A. With this, I'll hand over the call to the management. Over to you, sir.
Yeah. Good day, everyone, and I welcome you all for joining this call to discuss the impact of COVID-19 on our business. I'm Dr. Azad Moopen, Chairman and Managing Director. All of us are aware and worried about the havoc caused by COVID-19 pandemic across the globe, with contagion now reported from more than 150 countries. Governments and policymakers are making considerable efforts towards combating this, and I hope and pray we witness some positive outcomes from this initiative with minimal mortality, morbidity, and economic impact. It is extremely important that all of us follow suggested protocols to reduce the spread on social distancing, hand washing, using sanitizers, etc., along with self-induced quarantine if there is slightest suspicion of a respiratory infection or history of travel outside the resident country. Experts unanimously agree that there will be impact on world economy and various businesses will be differentially affected. Let me give you a status report on Aster DM Healthcare preparedness and plans. Our business was as usual till 15th March 2020, but there was minimal impact in the last 1 week. Footfalls in our primary care business, which includes clinics and pharmacies, have remained stable, but there has been decrease in the IP and OP counts in the hospitals. There has been a reduction in the number of elective procedures and surgeries being carried out both in GCC and in India. There is also an impact on medical tourism in India due to curb on international travel. Even though we have not seen material impact in our businesses so far, as the situation is evolving, we are unable to comment on the future impact on the business if the present situation turns worse. One of the positive points for us is that UAE has about 85% expat population who are between the age of 25 to 60 years. The mortality and morbidity of the COVID-19 is maximum beyond the age of 60 for severe cases requiring hospitalization. This provides little comfort as we believe that the impact on health system in UAE will be lower with comparatively younger population. As we have more than 60% of our business coming from Dubai alone, this will have a significant mitigation for us. In order to monitor and guide the frontline soldiers consisting of doctors, nurses, and support staff, the executive committee, which has all the direct reports to me, along with business heads for the hospitals and clinics, meet twice a week to take stock and provide protocols and procedures. Apart from this, each vertical and institution has their own COVID-19 task force who do the operational tweaking and implementation every day. We are giving utmost importance for the safety of our staff and have advised those who are in back office to work from home. We also have kept 1/3 of our staff out of regular duty on rotation so as to address any eventuality of the frontline staff getting affected by the disease. Our procurement division has adopted measures to make sure that there is no disruption in the supply chain. Though not connected with COVID-19, there were concerns arising from declining oil prices and its impact on our business. As you may be aware, around 80% of our business is from GCC and only 20% comes from India. Of the overall group business, more than 60% is from Dubai. As more than 95% of Dubai's GDP is non-oil based with little dependency on oil, the chance of any major impact on our business is low. However, the overall impact by low oil prices in other GCC countries may have some direct, indirect effects. We had found that when the oil prices dipped significantly in 2008 and 2015, we continued to have good business and CAGR growth maintained. We hope the same trend to continue during this dip in the oil prices also. Another concern is our capex cycle and free cash flow. To reiterate, I would like to state that we have placed highest importance on capex in our budget for the next financial year. This has become even more critical in this new environment with possible business impact due to COVID-19. Though initially we have estimated Indian rupees 480 crores of capex for financial year 21. Given the current scenario, we are reviewing existing projects as well as those in pipeline to reduce the capex further by keeping on hold or deferring some of our projects. We are concentrating our efforts to bring efficiency even in our maintenance capex and will consider only those expenditures which are absolutely necessary. Our focus now will be to conserve cash as much as possible and reduce debt. To give comfort to the investors, we would like to state that our liquidity position is sufficient to service our existing debt and meet our present commitments. However, as a proactive measure, we are in touch with our bankers to relax some of the covenants in future in case of a worst case scenario with significant impact due to the COVID-19 in the next financial year. Our key focus is to become more efficient in our operations by reducing our HR and material cost, strengthen our balance sheet by reducing the receivable, and create value for all our stakeholders by having free cash flow and dividend. Thank you for the time. We would now respond to any questions you may have. I will now hand it over to the moderator to open the floor for the QA session. Thank you.
Thank you very much, sir. Ladies and gentlemen, we will now begin the question and answer session. Anyone who wishes to ask a question may please press star, then 1 on their touchtone telephone. If you wish to remove yourself from the question queue, you may press star, then 2. Participants are requested to use handsets while asking a question. Anyone who wishes to ask questions, please press star, then 1. The first question is from the line of Jigar Shah from Maybank. Please go ahead.
Good afternoon, sir. My question is more general in nature about the COVID-19 situation. Can you give us some idea in terms of the testing situation currently in India and what you think would be a more ideal level of testing and what kind of costs are there for the testing and are you participating in that?
Sure. Dr. Harish, you would like to answer that?
Right. Thank you. Thank you for the question. So many of us from the private sector are part of a national task force, which is called the COVID Partnership Task Force, which in fact is led by Preeti Sudan, the Principal Secretary, Health, Government of India, and senior officers of Niti Aayog. And it has got the entire sectoral leaders from public and private sector involved. And one of our key requests to the Government of India was to liberalize the current testing norms prevalent, which only allowed the government certified centers in the public sector. Thankfully, the government has listened to it, and now their ICMR, which is the nodal agency for this, has issued revised guidelines, which also involves private sector. The current guidelines talked about institutions which are NABL certified laboratories and which have got molecular diagnostic services available. They may do so. So currently, the regulations say that the logistics of collection of samples and testing is being done, but the final reporting will be still done by a government agency. So this is what is happening. We are anticipating that this specific regulation will further be liberalized in the near future as the scenario changes. Thank you.
Yeah. So,
thank you, sir.
just to add to that, India has about 129 testing centers, mostly in the government and research centers and all. And the private, for example, we have the 2 places which have got molecular facilities. And it's very, very, minimal when compared to countries like Singapore or South Korea or even China, which had much more testing happening. And so the number of tests have to be definitely increased if you have to know what is in the iceberg phenomenon, what is submerged and what is not seen outside. So there is a requirement for that.
So just one small follow-up on this. Any idea on the pricing of the tests?
Dr. Harish, you have the pricing.
The government has already put a max price range of 4,500 rupees, and in which they have specified that for the initial screening test is 1,300 rupees and the balance is for the confirmation test. That's the current status.
And you are also at that price, making profit, or it is at cost?
At this stage right now, this 4,500 rupees is almost at cost price, but there is an opportunity that in the coming 2 weeks, the government might supply the kits free of cost. So there is a discussion on those lines.
Okay. Thank you.
There will be a large-scale screening of the population possible.
Okay. Thank you so much and all the best.
Thank you.
Thank you. A reminder to the participants to ask a question, please press star, then 1. The next question is from the line of Shyam Srinivasan from Goldman Sachs. Please go ahead.
Hi, thank you for taking my question. Just first one on the quantification of the occupancy, the kind of drop in terms of IPOP that was alluded in the opening remarks. If you could quantify, for the 9 months in GCC, we were at 55%, 63% for India hospitals. Where are we tracking now in the month of March and versus say Jan Feb?
Yeah. So, Srinath, you would like to take that question?
Yeah. So, Shyam, if you look at like what doctor said, until March 15, it was more or less normal, except for in India, where we had this medical value travel. That was not happening because that formed 5.2% of the total revenue. So that had an impact. But other than that, until 15th, it was more or less normal. But from 15th onwards, no doubt on the clinics and pharmacies, still the numbers were stable or slightly higher. But over in the hospitals, the OPD and the inpatient, both we are seeing a dip. But this dip was very negligible. But during the last 2 to 3 days, we are seeing a drop of close to around 20% on the occupancy levels. On the present occupancy levels, we are seeing a drop of close to 20%.
Srinath, you mean 20% admissions, right? Occupancy won't. You're not talking percentage points here. I'm assuming you're saying IP volumes probably are.
From a 55%, what was the 55% on an average? That will see a drop of close to around anywhere around 15 to 20%. Is what we are seeing for the next few days, based on next few weeks or whatever, based on the current trend. But that was not the case until March 15th. Until March 15th, whatever levels we were, that 55 to 60%, those levels were maintained. But the drop is happening during the last few days.
And Srinath, this is across both GCC and India, is it?
Yeah, it is across both GCC and India.
Got it. And what explains this, apart from the whole, medical tourism, you said 5%, elective procedures are being pushed out, but still, like everything else should still come in, right? Or is it because we are having a higher percentage of elective procedures, that's why we're seeing this kind of drop?
Yeah, so the thing is that if you see, like what we said, see, pharmacies and clinics, the primary care almost form 50% of the business. Now, over there, we have been seeing, especially on the outpatient side and as well as on the pharmacy side, we have seen an increase. But however, over there also now it has stabilized. The numbers from yesterday have stabilized, gone back to the normal. But however, in the hospitals, the dip is mainly because of the fear, because the elective cases, people are trying to postpone their cases. So unless and otherwise required, people do not want to visit the hospital. So many of the elective cases are getting postponed. And added to that, now what has happened in India because of this lockdown kind of a situation. So people are also not able to, from other places, they're not able to come to the hospitals freely. So all this is adding to the drop.
So Shan, just to add to that, this is Alicia. If you look at, especially in the GCC, a lot of the emergency and trauma have to go to the government. So if you look at the GCC hospitals, almost 85-90% of the cases are elective. So when you compound it with sort of general anxiety for the people to come to the hospitals, there is that lowering of numbers both on the OPD as well as the IP, which is happening in hospitals. In the primary care and clinics, what we are seeing is some surge in numbers, but that's mainly because anyone with a cold or cough or fever, they do want to go and try and see if they are eligible for testing. So they do have strict sort of eligibility criteria because kids are limited in number. They have to make sure if they're eligible, if they've had any history with anyone who's positive, and then only you can test. So that's why we are seeing increasing number in primary care, but that too on specific specialities. So some of these internal medicine and GP departments are seeing a spike, whereas you look at some other department, there is a gap as well coming through.
Well, it's very helpful. The second question is on some historical context. Dr. Moopen, Alicia, if you can tell us, MERS and SARS, maybe MERS was more in the Middle East. So what did you see in terms of the time taken for you to come back to normalcy? Is it 3 months, 6 months, 9 months? Or trying to come back to a more normalized state of affairs from a hospital perspective or from your healthcare clinic pharmacy perspective? Is there something that you can share to help us navigate this challenging time?
Yeah. So MERS and SARS, both this, even though severity of the both this influenza viruses, which belongs to the coronavirus group, were much more, the spread was much lower and there was no pandemic or even like an epidemic. It was very limited. One was in the Middle East in few countries, as well as the other one was in the South Asia. So, Southeast Asia. So the fear of this was very limited. So there was no clampdown, there was no lockdown, there was nothing like quarantine, self-quarantine, or none of these things were there. So that was much more smaller in the overall, that fear complex which was created, as well as actually the spread also. But the mortality and morbidity was much more higher for people who were affected. So answering your question, it didn't have a major impact on the businesses at that point of time. It is not something like which we felt that there is an impact produced by SARS or MERS. It was not there actually. So we haven't felt that it has produced any significant impact. So the recovery as such, it was business as usual, very limited impact only on business in India and GCC. Even though one is the Middle East syndrome, but still it was very limited.
Got it. Last question is on, you talked a little bit in your opening remarks of non-essential capex. Is there certain cost levers? I know a large part of the hospital business cost is fixed, but would there be anything that you could actually, during the interim, kind of tweak down so that you can try and maintain margins? I don't think that would be the case, and I don't think you're expected to maintain margins. But the idea is there something that management is thinking about other than non-essential capex, about other operating costs? Thanks.
Yeah, so this was a work in progress. The two levers which we are definitely looking at is the HR, which is about 50% of our cost, and then about 20% of our cost is towards the material. So this is very actively pursued, and this is something which was the most important levers which we are trying to address during this next financial year, to bring down the HR cost significantly, as well as to reduce the material cost to some extent. So that will be further looked at, and we are looking at ways in which this can be further addressed. Apart from other areas, there are certain departments, for example, which wanted expansion and the capex was required in the existing hospitals. So those things we thought that we could push, and that capex, apart from the maintenance caps, which is also small amounts which has to go to the capex, even though it is not new hospital and all, those things we want to reduce apart from the major capex.
Thank you and all the best.
Thank you. The next question is from the line of Apurva Kumar from Samina Capital. Please go ahead.
Hi, thanks for taking my question. Two parts to it. First, could you tell us a little bit more about within the GCC itself, how has been the reaction for different locations and different hospitals? And second, how would you see in the GCC region? Are you seeing any slowdown in number of cases, etc.?
Yeah. What was the second question? I didn't hear it clearly.
COVID occupation.
Sorry, in the GCC region.
The second part of the question, I didn't hear it clearly.
Yeah. So the question was, in the GCC region, have you started seeing any decline in number of patients coming in for COVID-19 related tests, etc.?
Okay. So, see, overall, when you look at the GCC, even though it is not uniform in all the countries, in most countries, there is the expat population, and there is a population coming from multiple countries. So they all have put on severe restrictions on travel, and they don't want people to come in or go out. So that has been there, like in many of the other countries. Looking at the impact or the number of cases, the largest increase is in Saudi Arabia, and Qatar also is significantly affected. UAE is affected, but not to the level or the numbers which are being published are lower when compared to the other countries. So we think that this is a phase where it will be now slightly going up before it comes down. The numbers which are being published will be increasing, and before it comes down. Like what I said in the opening remarks or initially in that statement, there is slight protection for the UAE, especially because of the population. This may not be there in Saudi Arabia or in Oman, where the indigenous population or the locals are much more when compared to the expats. Whereas this will be more in countries like UAE or in Qatar, where there is a healthy population or the young, healthy adult population who are not being severely affected by COVID-19. So we hope that the impact, even though it may spread and it may go to a community spread and all, ultimately it may go into that in the phase 3. But the impact on healthcare system, see, the whole issue is that how can you flatten the curve? It's very important that it doesn't go into a peak and the healthcare system is completely submerged in that. You have to flatten the curve so that the number of cases, it is over a period of time. If it is spread, then we can take care. The government as well as the private sector together can take care. We hope that we will have that advantage in these countries.
Right. Thank you.
Thank you. The next question is from the line of Ruchi Seth from L Capital. Please go ahead.
Hi, thanks for taking my call. I just want to understand what is the supply situation of testing kits in India in terms of what are the sources of supply, what is the lead time from supply to delivery, and is there like a demand-supply mismatch in India right now?
Dr. Harish?
Yeah, I couldn't hear the question clearly. Could you just repeat it, please?
Sure. Wanted to understand the supply situation of testing kits in India. What are the sources of supply? What is the lead time between supply and delivery? And is there a demand-supply mismatch given the demand from the 129 diagnostic centers right now?
Yeah, so one of the most important suppliers right now in the market for COVID-19 testing is from Roche, which is FDA approved. And there is a challenge right now because of the demand from various centers. We feel that at this point of time, we are able to manage the situation, but in the coming weeks, it can be challenging. So the government has been notified about it to look at to how do we mitigate this supply chain challenge is a big question mark in front of all of us right now.
Okay, thank you.
Thank you. The next question is on the line of Prakash Agarwal from Axis Capital. Please go ahead.
Yeah, thanks for the opportunity. Just getting things right, what you mentioned was Jan, Feb was more or less as usual and also till 15th March. It is some footfalls and the business has been affected from 15th March. So more or less my end of this year or the quarter is marginally softer, but if things continue, it will be more so the Q1 will be more impacted. Would that understanding be correct?
Yes, that is right. Because in the March quarter may not, because the impact of it, what we are seeing is in the last 15 days. And if we are expecting the trend and hope that it doesn't get worse from here on, we don't know next 1 week how it is going to pan out. So I think at least the way it looks like that quarter one could be impacted.
Yeah, and just to split the business, so if 20% is India business, which is largely out of pocket and some insurance, my 80% of the business is GCC. And how much would be insurance and government funded? Largely, mostly, right?
So here it is largely, if you look at almost 90% of the business is insurance. So it is largely insurance, and most of the countries over here also cover the COVID-19 patients under the insurance.
So do you expect something similar to what happened in Saudi, where we saw some write-off, or do you expect some delay in payment given the issues can continue for longer? What is our current assessment there?
See, if you look at in Saudi, no doubt at Saudi hospital, we have got of the total business, 40% of the business comes from the government. But this pricing is more or less similar to the insurance companies, unlike in the past where the government was paying more, because of which there was a write-off. So we don't expect any write-off. But if you look at the government business, our government business as such, if you look GCC, mainly on the GCC side, it only forms 3.6% of the total group business. But if we compare it to the GCC business alone, so that is around 4.4%. So other than Saudi, we don't have much of an exposure in the rest of the geographies. We have got very, very, very minimal exposure, and we don't see any write-offs from the government because government would like to take care of the people, and they will continue to pay. There is a possibility there could be some small delay. That possibility is always there. But however, we don't see any write-offs from the government.
And Prakash, just to add to that, I think the delay also we are estimating just because now people are working from home, there is reduced work hours. So just processing of claims, we expect that to take a little bit more time than it used to. But otherwise, normal course of business, but just because people have scaled down operations marginally.
Okay, and similar, do we think similar things for insurance payouts or?
Yeah, insurance also there is a possibility, like what Alisha was saying, that because even most of them are now working from home, so there could be some small delays, but we are in constant touch with the insurance companies because the need of the hour is that all the hospitals are taken care of because it is very important that the hospitals function to the full capacity to take care of the situation. So therefore, the government is also involved into it to see that there is sufficient liquidity for the hospitals as well. And we have made such requests both to the government as well as insurance companies, and they all understand it. And I don't see, considering all this, I don't see any significant delays from the insurance companies. Yes, for the processing and other things, there might be few small delays. But what we are also telling them is that instead of processing all the payments and other things, if they can also pay us advance, and the reconciliation could be done at a later date, because they are also tired of manpower and other issues. So therefore, considering all this, we could see some small delays, but not significant delays.
Got it. Thanks.
So just to add on to that, I just wanted to just tell you that in Dubai, where we have most of our business, GCC business, it's very broad-based. It is not that it is just 5 or 10 insurance companies, even though 80% business comes from about 10 insurance companies. There are about 20-25 insurance companies, whereas Abu Dhabi is different. There it is a large part of the business is by a single insurance company. So the risk of the payment getting delayed for a large amount of payment getting delayed, I don't think we are not anticipating that.
Okay, got it. Thanks for this. And lastly, you mentioned about, in the last 1 week or so, we are seeing some decline in footfall, 15 to 20%. So it would be in which segment, the Medcare, Aster, or the Access? Which part of the business is getting more impacted?
So this will be more in the area of the hospital, which means the Aster clinics and the Aster pharmacies, it won't be that much impacted because it's an outpatient business and people are coming because they are worried and they want to get checked up and all and to buy medicine. So that part is not too much impacted. Whereas in the hospital, both in the Aster as well as Medcare, but more so in the Medcare, there is a reduction in the number of procedures and IP and all. So the impact will be little more on the Medcare and little more on the hospitals rather than the clinics and pharmacies.
Okay, perfect. Thanks and all the best.
Thank you.
Hello. Can we invite the next question, please? Hello.
Are we connected, Sumanta? Or
yeah, we are connected. We are connected. Stanford.
Yeah, I can hear you guys.
Sriram. I think Shankar's line is slightly difficult to get to. Let's take the next question from possibly Apurva or Harith.
Not able to hear.
Stanford.
Just us on this side.
Thank you. The next question is from Shankar from HSBC.
Yeah, thanks for taking my question. I have just one question. Whether the health authorities have asked you to set aside beds for COVID, either in India or in Middle East? Beds or ICU?
Can you please repeat the question? I didn't hear it clearly. If you can just repeat, please.
Have the health authorities asked Aster to set aside beds or ICU for COVID-19 in case it increases, in case the infection rates increase in either India or GCC?
Yeah. So this is something which the authorities have requested. It's not that there is a mandated number of beds to be earmarked for this, but we also have said that we will cooperate when there is a requirement. Initially, there was a decision by the Dubai Health Authority that all elective procedures have to be stopped. In fact, we got a notice, but beyond that, we represented and they immediately lifted that ban, or they allowed us to do the elective procedures if at all something has to be done. So at that point, it was mentioned that we have to reserve some beds in case of requirement, which will be, say, 15-20% is what they have roughly indicated, even though they have been given a compensation for patients who are coming with COVID to be transferred from the government sector to the private sector. So which we are doing. In fact, we have got some cases which are transferred to our hospitals in GCC. In India, again, what is being discussed, even though there has been no directly, is that the government hospitals, including the medical colleges and all, will be the COVID centers in Kerala and Karnataka. And there will be the private hospitals will be asked to take the cases from the government at a reduced rate or whatever rate they fix, which may be something like the CGHS or whatever. They haven't disclosed that, for taking those cases for treatment. That is a non-COVID case. This is what has been unofficially told, but not officially indicated.
Okay. Thank you.
Thank you. The next question is from the line of Apurva Kumar from Samina Capital. Please go ahead.
Hi, just to follow up, what has been the impact of the crisis at NMC on your businesses, or generally the healthcare businesses in Middle East?
Yeah. So the NMC is a very unfortunate thing to happen, and there is actually it doesn't directly impact us. We were having some of our supplies coming from the NMC, their trading division. That is a direct contact with us, which is continuing, and we are continuing that relationship. But from the point of view of the other businesses, there is no connect with that. But there has been a perception about the GCC, about something going wrong and all, which some of our investors have asked us. But we luckily have been having everything very transparent, our debt levels or our promoter funding, which we don't have. There is no promoter funding actually. So these were the two major issues which we have clarified. But apart from that, there is actually a lot of doctors from the NMC who want to go to places which are more stable, which case-to-case basis we are looking at, because we also require doctors for our hospitals, and that may be something which will happen as we go forward.
Is there also a possibility of you considering taking over some of the hospitals that NMC has here?
This is not something which has come so far. The NMC hasn't decided what to do with their assets and all. But as we go forward, and if there is a model which we can adopt where the funding also is required, or if it is something like an operations management and all, this is something which we can't predict now, but that is something which may, as an opportunity, come in the next financial year, and we will be addressing it as and when it comes.
Okay, thank you.
Thank you. The next question is from the line of Agraj Shah from Tata AIA Life Insurance. Please go ahead.
Thanks for giving me the opportunity. I would like to know what's the status of private testing in Dubai and GCC overall. So is the private sector involved in conducting COVID tests over there, or it's largely limited to the government hospitals? Thanks.
Yeah, so the testing is limited to the government sector now. The government is doing that, and some of the private labs have been allowed to do that, but not the hospitals and all. So it is mostly concentrated, and the large part of it is done by the government.
Okay, thanks. That's it.
Thank you. The next question is from the line of Harith Ahmed from Spark Capital. Please go ahead.
Hi, good afternoon. Thanks for the opportunity. You mentioned in India, just like in the GCC, we're seeing currently around 15 or 20 percentage point decline in occupancy. Can you give some sense of what kind of impact we'll see on the ARPOBs, especially given medical value travel comes at higher ARPOBs and we're seeing a complete hit there. So should we be expecting a significant decline in India hospitals ARPOB if the current situation continues?
Yeah. Dr. Harish, you would like to take that question?
Yeah, since this situation we are only seeing from the 15th of March, I don't feel there will be a significant difference in RPOPs because most of our network hospitals are large quaternary care centers where the RPOPs are anyway high. It's just a marginal dip is all that what we expect. Things could change over the next few weeks, so we have to wait and watch this space.
Okay. And can you help us understand what is the role of private hospitals such as yourself in the testing area, testing part in India? Are you allowed to collect samples? And there's been some revised protocols over the weekend. So,
as I mentioned before, the government through ICMR has revised its guidelines to permit NABL accredited private labs who have molecular diagnostic infrastructure to commence testing. We are not allowed to report. The logistics are put in place where we can receive samples, we can test it, but the final confirmation will have to come from a government-approved center. So that's the current process. But almost every day there's change in regulation. So I expect this will also change as we speak.
So it's not just the list of labs that was published around 65 NABL accredited labs, 5 in Trendlyne.
Thing is, if the total number of COVID positive cases increases dramatically, which is what most people are fearful of, then they will have to further change the guidelines to increase even non-NABL accredited labs who have molecular testing infrastructure to start the process.
Okay, but that's not the situation now. You're expecting it to get there, or in case the number of cases go up, even the labs outside this list of 65 will be allowed testing.
Correct.
So that's the okay. And then one question on the GCC business. I think Dr. Azad mentioned in the opening remarks that the Dubai economy is not very directly dependent on oil, but there's a lot of indirect correlation with other oil-dependent economies. So, based on your experience from previous cycles, when oil prices corrected sharply, how has been the impact in Dubai, both in terms of volumes as well as receivables, specifically with respect to Dubai?
Yeah, in fact, we haven't faced this issue in Dubai where we didn't even feel that there is business degrowth or there is receivables impact or anything. The only place where we faced this was in Saudi Arabia, where we had a significant impact to government. And when the government's income went down in 2016 time, there has been this, the government cutting the cost and the overall, we had to take a haircut on that. So that is the only place where the huge government exposure and the last business that we had there, which we have inherited. In fact, we have bought that business. So that's the only place. But in Dubai, as such, we haven't found, and it's unlikely that it will happen because the dependence on oil directly is almost nil, and indirectly it is there, but still we think that it is more of more of other businesses which will have an impact here.
Okay. And on patient volumes, do you typically see a lesser inflow of patients that come from other GCC countries which are directly dependent on oil in previous cycles?
It doesn't, here we don't get too many patients coming from other GCC countries or other Middle Eastern countries. The amount of medical value travel happening into Dubai, even though Dubai is a good destination for developing that, is very low because of the high cost. because the cost here will be as much as they're going into a Western country, and people don't travel into Dubai for having medical value travel, except in some of the situations like some cosmetic treatments and all. So it is very minimal that we will have an impact, like people coming from other countries not coming here and the business going down. That's not really there. Whereas in India it is an impact, but here I don't think that's going to be an impact.
Okay. Thank you very much.
Thank you, Edith.
I'm done with my questions.
Yeah.
Stanford, can we take the next question, please?
The next question is from the line of Tushar Manudhane from Motilal Oswal. Please go ahead.
Yeah, thanks for the opportunity. Just on the diagnostic part, firstly, if you can let us know the number of tests you can do per day and the number of kits that are available currently for the India hospitals.
So I don't have an objective number at hand, but for example, our Calicut Hospital, which is an NABL accredited lab, and it has a full-fledged molecular diagnostic unit. In the past H1N1, the swine flu epidemic, we did manage quite well. So we have adequate kits right now to do the required testing. So that should not be an issue. We are also trying to expand molecular diagnostics to our Kochi facility, which is anyway an NABL accredited lab. We are also upgrading the molecular diagnostic services there. So that process is on right now.
Good. Because of this lockdown, are you seeing any disruption in terms of availability of equipments or medicines?
Actually not, at least where India is concerned, because of the proactive measures of the government of India to ban exports of essential supplies. There is enough stock available within the country, but there are some feedbacks from manufacturers that some input materials costs have gone up, mainly for this what we call a 3-ply mask and sanitizers. So this is something which we have also in the task force, which we have national task force. We have also sensitized the government towards challenges being faced by the manufacturers. At this point of time, we don't have any short supply for anything.
Got you. And just so both on India as well as GCC business, with reduction in OPDs and to some extent IPDs as well, would that have impact on the pharmacy business as well?
Yeah. So the pharmacy business, in fact, what we have found is that it has not been impacted too much. If you look at in the last, even the week where we had an impact on the hospital business, the pharmacy and clinic business has increased because of this, or at least it is neutral or slightly more when compared to the previous week. So I think that is not a concern because pharmacy is the only thing which is kept open along with some provision stores and all in some of the countries. So that's not going to have a major impact because it is coming from the outpatient department. So the major impact is going to be the elective procedures in the hospitals, which people will try to postpone.
Got it. So this would be due to the stockpiling of the medicines, the initial higher offtake of the medicines from the labs. But with this patient flow itself reducing, and if that continues for another 15-20 days, then will that have any impact on the pharmacy?
Not really. We don't keep too much of a stock. Our revolving stock is not a very high volume. There will be some items which are stored specifically for this purpose, but I don't think that is going to have an impact on our inventory or on our overall working capital. I think it is manageable and it is not something of a concern.
Okay. So Kushal, to add to what doctor said, we don't see any major, unlike the provision items where people are hoarding. So at least on the pharmacy side, we are not seeing such kind of hoarding. So what is required is what people are buying, because they're anxious and other things, they're buying something more. Maybe what could happen is that in the coming days, that will taper down, which we are seeing that tapering down happening. But however, the occupancies where we are concerned, we don't know which way it's going to go. Whether the occupancy levels in the inpatient, whether it is going to increase substantially because of the COVID patient, or whether the elective cases are going to fall from here drastically further. So these are some certain questions which we are not able to answer, because every day it is changing. So what we are talking today about a 20% drop in the occupancy could be anything, maybe tomorrow, day after tomorrow. So we don't know whether there will be a surge of patients or whether there will be a drop of patients.
But just also to add to that, I think one of the things we're seeing in the pharmacy is there is increased sales for things like vitamins and so just immune boosters and things like that. So some shifts. So while maybe because the OPD has come down, there's a reduction as far as the pharma sales is concerned. But then there is an increase on other items such as multivitamins as well as sanitizers and all the other things that people are kind of hoarding on.
Got you. Good. That helps. Thanks. Thank you.
Thank you.
Stanford?
Are there any more questions? Two more. Okay.
Stanford, are you there?
Sumanda, are you getting the moderator? Is he there?
The moderator is getting connected. I think there is some problem in the line, so that's why he is getting dropped very frequently. So I'm just trying to reach out to him continuously.
I think there are two more questions.
Two more questions are there, so that's why we are not discontinuing the call. He is connecting. He's reconnecting, sir.
The next question is from the line of Apurva Kumar from Samina Capital. Please go ahead.
There was this recent news that UAE government has allowed 100% ownership in healthcare businesses, and there was a follow-up saying that Aster is in process of approving, approval for getting 100% stake. Could you just update us on the status of this process?
Yeah. So we have almost completed that, and this process is over for Dubai, for both our GCC, both our hospital clinics as well as pharmacy business. So large part of the business is already completed, and even in geographies like Oman and all, where we had this opportunity, we are in the process of getting it done. Saudi anyway was 100%, Bahrain was 100%. The only place where it may not happen is in Qatar. So that process, as we promised, we thought that we will be able to complete it by end of this financial year. To a great extent, it is done and dusted. There will be something which is left, like in some of the Emirates of UAE, where the process is going on.
So right now, what is pending is Medicare vertical that is pending, and pharmacy vertical is pending. That is mainly for the reason is that some of the government offices are they are not been working. So if they start working, I think by the year end we should be in a position to complete even these two.
Thank you. The next question is from the line of Chirag Dagli from HDFC Asset Management. Please go ahead.
Yeah, so thank you for the opportunity. Srinath, anyway, Q4 is a very strong, is the strongest of the 4 quarters for us. You're saying business has been as usual till 15th of March. There shouldn't be too much of a change to our full year outlook, right?
See, that is what we are expecting. But this 15 days, if you look at, there has been right now we are seeing a drop. Now, how is it going to pan out in the next week also matters. If this drop is going to become much higher, then definitely there could be an impact. But it will not be a material impact if you look at the full quarter. So definitely there will be a drop because to what has been happening around. Because we had an impact of MVT in India for the full month. And from 15th onwards, we have been seeing that impact. So definitely there will be an impact, but it may not be a significant impact.
And in the summer months, when things could probably, aggravate a little more. Anyway, we were not expecting a lot of business. Is that understanding right?
Yeah. So summer months, at least in the GCC, for us, Q1 and Q2 is low. So we don't know how that is going to pan out this time around because generally Q1 the expatriates used to go out to the home countries mainly for the summer vacation. In case they're staying back, then there is a possibility that we may do better. But as, we also don't know once the lockdown and other things are lifted. There might also be a situation where many of them would like to go back home. That possibility is also there. Keeping our fingers crossed, we'll need to see how it's going to pan out. But generally, Q1 and Q2 for us, these 2 quarters are low quarters.
Understood. And how is the Saudi hospital done in the 4th quarter, sir?
Sanad is, it's doing better than it was in the summer months. I think we're seeing some recovery, still in single-digit margins. That's how we expect it to close this year. So last year it was just around break even. So we expect some single-digit margins for the year-end close. But there's been at least positive traction in terms of the feedback from patients. I think one of the biggest issues we had with that unit was there was a lot of negative feedback in the initial years because it used to be just a long-term care facility and service levels were not really up to the mark. So we're seeing a positive movement as far as service levels and that patient feedbacks are becoming much more positive. So hopefully over the next 1 or 2 quarters, we will start seeing that impact on the business with increased footfalls as well.
Q4 should be stronger margins than even the high single digits, right, Alisha? Given that, it should be the strongest of sales.
For Sanad, in all the GCC countries, your Q4 is going to be, the strongest one. So Sanad included.
So the margin will also be better in the 4th quarter.
Yes, it should
be. Understood. And the last point, sir, if you can just throw some light on, Dubai, there is an understanding that, the virus sort of does not survive high temperatures. How do you subscribe to that view, and what is it that you've seen in Dubai or in other, GCC countries?
Yeah. So there has been this theory or postulation that this virus survival is less on hot weathers, and this is to some extent it's also evidence-based because if you look at this has come in the 30 to 50 degree latitude countries mostly, even though there has been exceptions like in Singapore and South Korea and places like that, but the impact has been maybe due to the management by those countries or by the weather also supporting them. Anyway, it has been more in the temperate countries, and it has been much less when we look at the Indian subcontinent or in the Africa, or for that matter in the Middle East. So except Iran, that's again a little colder when compared to the Middle Eastern countries where we are operating. So there is some amount of circumstantial evidences that this survives more in the winter. And if you look at colder weather. If you look at traditionally, if you look at the influenza, which has come even earlier years, traditionally this was coming during the fall or winter, which means that this is surviving more in the colder weather. So as the temperature increases in the Middle East as well as in India and all, there will be some partial protection is what we are feeling, which will have a positive, or it will at least it will not go into a stage where other countries are suffering now. We hope that this will be some amount of protection.
Understood. Thank you so much, sir. This is helpful. Thank you.
Thank you.
Thank you. The next question is from the line of Charulata Gaidani from Dalal & Broacha. Please go ahead.
Yeah, sir, in India, do you expect any impact because of COVID, and to what extent?
Like I mentioned before, it's only from 15th of May, specifically from the Prime Minister's address to the nation, where he had asked people not to crowd hospitals and also requested citizens of the country to postpone elective procedures. So that has, we can see that impact in Indian hospitals, both in OP as well as in elective surgery. At this point of time, our hospitals, we have 13 hospitals. They are all in touch with district administration and following guidelines of the respective governments. The lockdown itself is having an impact because naturally movement in and around cities have been totally blocked out. So that also impacts business. But at the same time, we can see there are ICU admissions because emergency patients still have to come. So things like an acute MI coming for cardiac procedures, trauma cases, other ICU admissions, those are continuing as before. We don't find any changes in that. We can't predict what will happen in the next few days. So we just have to wait patiently and see the evolving situation.
Okay. Okay, fine. Thank you.
Thank you. Ladies and gentlemen, that was the last question. I now hand the conference over to Mr. Sriram Rathi for closing comments.
Yeah, thank you. I thank the management of Aster DM Healthcare to provide us this opportunity to host this call, and I hope the call was useful for all the joinees. Thank you so much.
Thank you very much, sir. Ladies and gentlemen.
Thank you very much. Thanks a lot. Thank you.
Thank you.
Thank you.
Thank you. Ladies and gentlemen, on behalf of ICICI Securities, that concludes this conference. Thank you for joining us, and you may now disconnect your lines.